Applied Medical Technology is a global leader and manufacturer of enteral feeding devices and accessories, upholding the highest standard for performance and quality assurance. Since 1985, our core business has been enteral device product development, design, manufacturing, and engineering in a state-of-the-art facility near Cleveland, Ohio. AMT strives to provide the best medical device products to our customers to increase patient comfort and improve patient outcomes. Our products include the MiniONE line of low-profile balloon, non-balloon, and capsule non-balloon buttons, the AMT G-Jet low-profile gastric jejunal enteral tube, and the AMT bridle and microbridle nasal tube retaining system. All AMT products are proudly made in the USA. As a caregiver or patient, we believe you have a right to the most comfortable and reliable enteral tube, which is why we developed the MiniONE line of products. Watching this video and referencing our patient education guide will help provide you with the guidance and support needed to understand enteral nutrition. Proper nutrition is essential to maintaining your body's health, growth, and ability to heal. It is important to understand how the gastrointestinal or digestive system works to understand enteral nutrition. The digestive system is made up of several hollow organs joined as a long tube or pathway through your body. Digestion begins in the mouth through chewing the food you eat into smaller pieces, which are then swallowed and passed down the esophagus. The esophagus carries the food from your mouth to your stomach. Once in the stomach, the food gets broken down into its main nutrients. These nutrients then pass into the small intestine, where they are absorbed into the bloodstream. Once through the small intestine, the remaining material passes into the large intestine, where excess liquid is absorbed, leaving solid waste product behind to be passed out of the body. Various medical conditions may make it difficult or impossible for a person to eat orally, denying the body of essential nutrients. In such cases, your physician will select the best type of alternative feeding for your situation. A gastrostomy tube, also known as a G-tube, may be inserted through the abdominal wall to provide direct access to the stomach for feeding. The MiniONE Balloon Button is a low-profile or skin-level G-tube. A G-tube is a convenient and effective means for delivering nutritional formulas to the body. These nutritional formulas are either commercially available or homemade using a food processor. A physician will prescribe the proper feeding procedure, formula, and amount of water for effective feeding. A feeding tube, like AMT's MiniONE Balloon Button, is used for people who cannot swallow food through their mouth or are unable to get the proper amount of nutrients to meet their current needs. The AMT MiniONE Balloon Button delivers a liquid food or formula directly into the stomach by bypassing the mouth and the esophagus. Once the formula enters the stomach through the MiniONE Balloon Button, digestion works the same as when food begins in the mouth. The same nutrients are delivered to the body through a feeding tube as it would be by mouth. Tube feeding with the MiniONE Balloon Button gives the button user a complete and healthy diet so they can continue to grow and develop. It will take time to adjust to tube feeding at home, but with the help of your healthcare professionals, this video, and some practice, you will gain the confidence to take care of your MiniONE Balloon Button. The MiniONE Balloon Button has several components. The external bolster with lot number, a glow-in-the-dark feeding port, safety plug, balloon valve, anti-reflux one-way valve, and an internal retention balloon. The MiniONE Balloon Button comes in a wide variety of sizes to fit your needs. It is measured in FR, or French, which is the diameter of the tube, and by cm length, which is the stoma length, or the distance from the exterior abdomen wall to the interior of the stomach wall. Your physician will determine what size device you will need. Keep in mind that not everyone has the same basic growth and development needs, so make sure to get remeasured every 6 months. The MiniONE Balloon Button has a glow-in-the-dark feeding port, which is used for administering food and medication directly into your stomach. A special anti-reflux valve in the button is opened when a feed set is pushed into the feeding port. This port can also be used for decompression, which is the venting or releasing of gas or liquid from the stomach. The button is held in place. in the stomach by a balloon inflated with distilled water. The balloon valve is used to inflate or deflate the balloon, and the recommended fill volume is printed on the top of the valve. A unique advantage of the MiniONE Balloon Button is the apple shape of its balloon, which covers more surface area around the stoma to create a better seal, minimizing leaks. Additionally, the MiniONE Balloon Button has an exceptionally low profile and is soft and flexible for comfort. The MiniONE Balloon Button comes with the MiniONE Balloon Button, an introducer stiffener, continuous feeding set, bolus feeding set, slip tip syringe, and a catheter tip syringe. We'll talk more about these later. Let's get started with an example of a feeding routine. Your healthcare provider will decide which type of feeding is best for your situation: continuous feeding with a pump, bolus feeding with a gravity bag, or bolus feeding with a syringe. No matter which method is used, always wash your hands thoroughly before handling any feeding devices or preparing any formula. Before administering food or medication, the patient should be in a slightly elevated position and stay upright for at least 30 minutes after feeding. Gather all the needed materials and put them in one location for easy access: formula, feed set, catheter tip syringe or enteral feeding pump, and water for flushing the tube. To make it comfortable and easy to clean around, the MiniONE Balloon Button is made from highly flexible and soft silicone. Because it is flexible, it is important to stabilize the button to avoid pushing it into the belly when attaching a feed set. Hold the button firmly between the balloon valve and the feed port. Line up the black line on the feeding set connector with the black line on the button. Make sure the feed set connector is pushed in completely and gently turn it 1/2 to 3/4 of a turn clockwise. When fully locked, the adapter will stop. Do not force the connector past a 3/4 turn. To make nighttime feedings easier and to help avoid waking the patient, the feeding port and connector glow in the dark. Before connecting the feed set, take a moment to expose the connector to a light source for about 10 seconds. This will activate the glow-green material. Then you can proceed without waking the patient. If you have trouble turning the connector, check to make sure it is pushed in all the way and nothing is blocking the feeding port. Do not try to force the connector. The feeding set connector process is the same for both continuous feeding sets and for bolus feeding sets. Always prime the tubing first. Attach the feeding bag tube to a right angle feed set and clamp one or both tubes. Pour the prescribed amount of formula into the feeding bag. Unclamp the tubing to allow the formula to flow through, pushing the air out to prevent it from being pumped into the stomach. Once the formula reaches the feed set, reclamp it to prevent the formula from spilling. Then attach the feed set to the MiniONE Balloon Button and begin feeding. Follow the instructions from your pump manufacturer to operate your continuous pump. When feeding is complete, flush the feeding set with the prescribed amount of water, typically 5 milliliters for children and 10 to 20 for adults. Disconnect the feed set and wash it with warm soapy water. Hang the feeding set so it dries with water dripping out. To eliminate messy feed set pullouts, try using the AMT clamp device, which secures the Y-port adapter to a stepped connector. Other methods of feeding are drip feeding via gravity or bolus feeding with a syringe. Follow the instructions given by your healthcare provider to determine the rate of flow and the best feeding procedure for you. Keep the stoma site clean and dry. Wash it daily with mild soap and warm water. Using one end of a swab or cloth, gently clean underneath the device. Using the other end of a swab, clean the feeding port. Turn the button every day to allow for air circulation. You should be able to do a full rotation of the device with little to no difficulty. The external bolster should not fit tightly against the skin, restricting movement. Instead, a 1/8 of an inch gap between the external base and the skin surface is recommended to provide room for air circulation and cleaning. Patients with buttons can swim and bathe. A good time to clean the stoma is during a bath. Let the stoma site air dry after cleaning. Check for redness, pain, swelling, or unusual drainage. Call your healthcare provider if any of these symptoms are observed. You shouldn't need gauze or pads. If there is leakage from the stoma, the button may be too long or too short for the stoma, and the site should be remeasured. As the button user grows, ask your healthcare provider to remeasure the stoma on a regular basis with an AMT stoma measuring device. Babies and younger children who are growing rapidly should have their stoma lengths remeasured more frequently as determined by their healthcare provider. Buttons can dislodge if they are too short for the stoma's length, so it is important to remeasure regularly. You should always have an extra button on hand in case the button is accidentally dislodged, falls out, or is removed. If this occurs, the stoma site may start closing within hours, so you will want to replace the device as soon as possible. Your healthcare provider may recommend that you check or modify the balloon fill volume on a regular basis. To do so, remove the water from the balloon using the slip-tip syringe. Replace the water with the amount prescribed by your healthcare provider. The recommended fill volume is printed on the balloon fill valve. Its unique design allows the MiniONE Balloon Button to accept different balloon fill volumes. By customizing the size of the filled balloon, you can get a better fit and help stop leaks. Do not exceed the maximum recommended fill volume, which is printed in the patient education guide. Wash feeding sets and syringes with mild soap and warm water after each use. Do not put them in the dishwasher. Rinse thoroughly and allow to air dry. If using continuous feedings, you should clean the feed set daily. Always flush feed sets with water after feeding to prevent clogging. Contact your insurance provider regarding the number of feeding sets you are allowed per month. The port of the MiniONE Balloon Button can also be used for decompression, which is the venting or releasing of gas or liquid from the stomach. Venting the stomach helps relieve abdominal pressure. Connect an open blunt tip syringe to the end of a feeding set adapter, and connect the feeding set to the button. The anti-reflux valve in the button will be opened, allowing the stomach contents and gas to pass freely up and out of the tube. To help release air, raise the feeding set about 6 inches. When delivery of medication is indicated, you can use a Mediport. Do not attempt to change your device without proper training from your healthcare provider. If you have been properly trained by your healthcare provider, this next section will act as a refresher on how to change your MiniONE Balloon Button. Your healthcare provider will recommend when to replace your button. Contact your insurance provider about the number of G-tubes that are covered per year. Inspect the button kit for damage. Do not use if the seal is broken or contents damaged. The label on the tray has 3 peel-off stickers. Remove at least one and save it for reference. A great place to save the label is on the information card in the patient education guide. Place a small amount of water-soluble lubricant on a gauze pad or other clean surface so it will be available for use. Apply lubricant around the stoma site. Gently raise, lower, and rotate the button to spread the lubricant. Deflate the balloon by removing its water with the small slip-tip syringe. While maintaining an even pressure on the abdomen around the stoma site, pull the device up slowly and remove it. Pre-fill the small slip-tip syringe with the prescribed amount of distilled water you will be placing in the balloon. The recommended volume is printed on the fill valve. Do not fill with air or saline. Place the blue introducer into the button, being careful that it does not extend past the end of the button. Using the blue introducer is optional but may make placement easier. Your new device is now ready to insert. Apply water-soluble lubricant to the tip of the new button. Lubricate the stoma and then guide the new button through the stoma. Stop when the base of the button is on the skin. Do not be surprised if the button needs to be put in at an angle. Once the button is in place, remove the blue introducer. Hold the button in place and inflate with distilled water to the prescribed fill volume. Do not inflate with air or saline. Gently pull up to make sure the balloon is filled and held against the stomach wall. There should be about 1/8 of an inch, roughly 3 millimeters, between the skin and the bottom of the device, about the thickness of a nickel. Rotate the device. It should not be too tight or too loose. Some healthcare providers recommend that you ensure the button is in the stomach by checking for stomach contents. To do this, connect a feeding set to the button and using the large syringe, gently draw back until stomach contents can be seen in the feeding set. You may hear a release of gas from the stomach into the feeding set when it is inserted. Once you have observed the stomach contents, make sure to return them back to the gut. If contents or gas are not observed, call your healthcare provider. Do not feed into the device until proper placement is confirmed. Check for leakage around the stoma. If leakage is seen, you may customize the MiniONE Balloon Button to better fit the stoma. Add an additional 1/2 to 1 milliliter of water to the balloon until leakage stops. Do not exceed the maximum fill volume of your balloon, which is printed in the patient education guide. For troubleshooting or special tips on use, refer to the patient education guide that comes with each button. The guide is also on the AMT website, www.appliedmedical.net. Many patients have found the MiniONE Balloon Button to be very comfortable due to its lower profile, making it easier to conceal under clothing. The device is made with the highest grade medical silicone, which is soft and strong, allowing greater flexibility to the device. Its apple-shaped balloon helps to reduce leaks, skin irritation, and discomfort by creating a better gastric seal. And its unique glow-in-the-dark button port and feed set connector make nighttime connections much easier, providing better outcomes for tube feeding. AMT, the leader in enteral device innovation, designed with the patient in mind.